note. Yeah. She.
I'm
It's
putting
good if
you
she
on
can-
video, Dr. Waldman, because
Oh.
we have to document everything. If you don't
Okay.
want to be on it,
Okay. Well, I wish I would have done my hair. Oh, I showered.
look at me. Well, it won't show on video. Look at how pretty she is. This is Dr.
I'm in
Waldman.
big trouble. No,
So-
what I like that's a little bit better with these brachial plexus avulsion dogs is that she actually she progresses the whole foot sometimes, and sometimes it touches right here.
Yeah.
That's why she has that nail wear like that.
Okay.
But that's good, because
Okay.
a lot of them are only like this, and they
Yeah.
only,
Yeah.
but she 1 or 2 times
Yeah.
got her foot out a
Okay.
little bit more. So that's a little bit better, because this is a tough injury.
I know.
This is a tough one.
I know,
So
and
that's
we
good.
were considering amputation
Yeah.
until we heard about you. And
No
anyway,
pressure. No pressure.
so
So she's like an in-between.
in between,
Like
so there
a
is hope.
moderate. There's hope. It's long and slow, and
Yeah.
we hope.
Yeah. So here is the little Buttercup for our first acupuncture session, you guys. She's starting therapy, and I want to thank all our sponsors who've seen her and have donated. It's happening now. So Dr. Waldman right now is feeling the little girl out.
What I'm seeing is how much straightening or extension she has in her wrist.
Mm-hmm.
Because in order for her to walk, she has to be able to straighten it.
Mm-hmm.
And right now she can't quite straighten it all the way comfortably, and I can tell that by watching her licking or getting nervous when I go closer to straight.
Mm-hmm.
So almost, but she needs a little bit more.
Okay.
You're pretty, doggy. Oh
She's
my
so
gosh,
sweet.
you're sweet. Are we gonna
So
get that
sweet.
working? What do you think, Mama?
Well, we have high hopes, right?
We have positive visualization that we can do it.
Okay. You heard it here. Thank you.
You heard it here.
She's getting
Electro. She's doing good, Mama.
See? So now you put the acupuncture in, and this, what is this, Dr. Waldman?
This is just electro acupuncture, or sends a small current to the acupuncture needles.
Mhm.
So the studies actually show that electro acupuncture has a little bit longer effects than regular acupuncture.
And how long does the thing last approximately?
Around 15 minutes.
15 minutes. So you got to keep her still for that time.
But right now, acupuncture makes them kind of sleepy and sedated, and you can see she's already kind of calm. So it's usually not very hard. Although it's her first time, so it's harder, but she's being such a good girl.
She's such a pretty girl.
And a good girl, too.
Yeah, she is a good little girl. I'm hoping this works. It's going to be so cool. Dr. Waldman is going to tell us what's next.
Okay, I was just talking about how the home care you guys do is so important. Because this isn't an easy case, the odds aren't necessarily for it working. And with the neurological rehab, if you think about like a stroke patient, think about how they live in a rehab clinic, and it's like people are coming several times a day, PTs are coming, and that's the kind of amount of care she need. So the combination of the flexibility issues, like getting the wrist straight and keeping, the fingers flexible, that's you don't have to do as often. But pinching the toes, working on sensory inputs, working on pinching and the brain feeling and tickling the feet and all those things, that really has to be done as many times a day as possible.
Okay, and how long does each little session?
It kind of depends on what works for you guys and who's doing it, but 5 minutes, 10 minutes.
Okay.
And the other
Several
thing that
times
would
a
be
day.
as important is working on her standing balance, standing posture.
Okay.
And that I think we probably showed him the first day, and we'll always review with you guys, but when she stands and the shoulders dropped and she knuckles, he fixes it
Mm-hmm.
and he tries to get her to bear a little bit of weight on it.
Okay.
So the concept with neuro rehab is frequency.
Okay.
Frequency,
Thank you.
it's not like a long, it's
Right.
just over and over.
Over and over again. Yeah. Repetition, basically. Okay. Well, thank you so much for this. And then the little girl right now is enjoying. Yeah, apparently acupuncture has a sedative effect. So look at the little girl now. She's just, but we're going to figure it out. Maybe I can find a local foster, which might be the best case scenario that would have the time to do this. And when I say that, it could be me, of course, because I don't
It's
have
funny,
enough.
I see a local foster right here in the room with us.
I do too. Stephanie, tell me what you think about that.
I would love to, but I have 3 cats.
I told you she's great with the kitties.
One cat can't even walk.
Well, that would be 2 patients for you. Thank you.
Thank
We're through the session here of acupuncture, and look how peaceful Peanut Buttercup is. And she's very, very comfy with Stephanie here. Yes, Stephanie, you are on the spot here. But look at the baby girl. How is it feeling, Peanut Buttercup?
I'm feeling good.
Are we feeling good and relaxed? Oh, this is nice, isn't it? And you got the nice little music in the background. This is almost like a little spa.
Yeah.
It's like a spa day for you. Peanut Buttercup is making friends everywhere she goes.
Yeah.
And now, where are we going, Stephanie? We're going to
The gym.
the gym.
Some exercises.
So the spa day is over. Now it's exercises, my little mama. Okay, so we're gonna. Buttercup is making friends with that big boy who can't walk, and he loves other dogs. Look at this. Oh my God, it breaks my heart. He is so excited. This is such a gorgeous baby. Oh, Buttercup, are you playing hard to get? Oh, you are priceless, little guy. You really are. It breaks my heart. This dog has been here for 5 years. Cannot stand up and is the happiest. Choco and Jen are going to start the physical therapy of Peanut Buttercup now. And you can tell me what you're doing if you want.
Sure. Actually, I want to begin with her just getting to know me. This is her first time back since the initial evaluation. And what I tend to find often is that their very first follow-up following the initial evaluation, they're very nervous and scared. Even if their tendency is not to be a nervous dog, they're still nervous and scared. That's just common. And I think the reason is because the initial evaluation is so long, and oftentimes getting the measurements requires creating a little bit of soreness. And so then afterwards they're sore. So then the next time they come in, they react on instinct and they expect it to be just as stressful and grueling. So if we introduce ourselves to them, and I tell you what I'm doing, which is just loosening your neck a little bit, getting you used to the process. Once their instincts kick in and they realize that they really do feel better after the treatments, then what tends to happen is they look forward to coming to their visits and they even participate in their exercises themselves.
Do you hear this, Buttercup? We're counting on you to participate going forward. Not be a dead log on the floor.
It's true. A lot of the owners will tell us that the dogs will actually help with their stretches, that they'll see that their dogs are trying to do their stretches on their own, that they'll start to do some of their own exercises.
Oh, that's amazing.
We've had owners that have said that the dogs figure out when their appointments are and wait by the door.
Oh my God. This is out there.
But it takes a little bit of time to get there.
Yeah.
And so, feel that? Nice.
It's okay. Buttercup.
It's okay.
Buttercup. It's okay. Good girl. I know, it's so boring,
There, good stretch. Right, and listen, Buttercup, I'd really like to look at your other arm, okay? All right? This is going to be the scariest part of everything. And it's not even gonna
Good
hurt.
girl, Buttercup. Good
See?
girl.
See, it doesn't hurt. See? Yeah.
It's okay, please.
It doesn't hurt. It's
Girl.
Good girl.
Good girl.
Don't listen to other dogs. It's okay.
Good girl. Good girl. You're almost done, okay? You're okay. You're okay.
So now you're seeing to see how far she can stretch that leg up.
Exactly. And I'm also trying to feel the quality of the motion.
What a good girl, Buttercup. What a good girl. I know there's other doggies.
Oh no. It's okay, baby girl.
You
You're
just
doing
wanna play,
so
huh?
well. So well. We're so impressed with you. First time therapy session. You are doing very well. Your doctors are agreeing.
Yes, definitely.
She's a very special girl, isn't she?
She is.
Good girl. Good girl, Buttercup. I know. It's not fun.
This wrist is rather stiff. We've got some work to do on this wrist.
What does it mean?
The joints in the wrist are actually rather stiff.
Okay.
And the muscles on the other side that are used to allow the lengthening, those are a little tight. So those are definitely two things we need to work on.
Do you think, I mean, she doesn't seem to be in pain per se, which is puzzling. Or is she just so used to it? I mean,
There's a few different options.
It's okay, baby. It's okay, baby.
Different handle pain differently.
yeah.
Good girl, baby.
Some of them handle it very, very well. Some don't handle it very well at all. Also, sometimes nerve injuries, it takes a while for the nerves to regenerate, and so there really isn't a whole lot of pain signals going to the brain yet. And so she may start to feel more pain as the signals regenerate. Sometimes I use the analogy of
Good
if,
girl.
you know,
It's
for
okay.
humans, if you were to sit
Good
on your
step,
foot
Buttercup.
until it went to sleep, and then you go to stand up and it's tingly,
Right.
and how it kind of hurts a little bit. Sometimes they experience similar sensations, just not as dramatic.
A good girl, baby.
The things you're doing right now, is this something that we also need to do?
No,
Or, no, okay.
I have to be needed for something.
Okay.
No, actually, what I'm doing is joint mobilizations. It's moving little tiny individual joints to try to gain some motion
Okay.
between them.
A good girl, Buttercup.
You are doing so well.
Good
Peanut
girl.
Buttercup. My precious girl. My precious little peanut. I'm gonna make you feel all better down the line, I promise.
Because in order for her to use this arm,
Uh-huh.
and we got to get strength, of course.
Yeah.
But functionally, she has to have enough range here and here to get her foot flat on the floor.
Right.
Right now, she doesn't. So even if she had strength, as soon as she steps down, it's going to go like this because there isn't enough range in the joints yet.
So that's what the physical therapy is
Exactly. So that's what the physical therapy.
Extending that range.
Exactly, extending the range. And that's why sometimes the additional help of a therapist or a rehab specialist is needed to just play and get some strength back to her arm. If she doesn't get the range back, she's not going to be able to put it
Exactly.
down.
You want it flat. And is it something like based on what you've seen, and I'm sure you've seen plenty, is it a hopeful case?
Yes, it is.
Thank you.
Yes, definitely. Now, I should qualify it just a little bit and say that I know I can get better motion in the wrist and the fingers. I know that because I could feel it, and I could feel the joints moving, and I could feel the range improving. Now, after that happens is when we'll start some strengthening to use the muscles around the arm. I don't know how well those muscles are going to work until we start trying to use them.
Yeah. Well, I mean,
There
it's a
is the
try.
possibility that the muscles won't work. So I'm not going to sell you the Brooklyn Bridge.
No, and we get it.
So-
I mean, from the get-go, you said that, there is a potential, but it's a 50-50% chance.
Right.
So,
But I can definitely get more range in this wrist, and I can get more range in the digits.
okay.
That I can definitely do because I could feel it loosening as it was happening.
Well, that's great.
Yes, that's the start.
Jen, what are we doing
Yes, so now we're going to do cold laser, and the purpose of the laser is actually to help improve healing. It actually speeds the healing process overall, and it's also going to stimulate some endorphins, which will help with pain control. It'll help her to feel a bit better after today's session.
now? And how long overall does this spot last? A few minutes?
The laser itself,
part?
only a few minutes.
Yeah.
Not very long at all.
She seems to be reacting to it. Does she feel it?
She doesn't.
She doesn't feel it.
I can do it on you and show you. It's just light.
Yeah.
My theory, like I said, I've been working with the animals for 3 years, and I worked with humans for 12. And my theory with the laser, with the animals, is that because they don't feel anything, they can't figure out why they're being held still.
Exactly. Yeah.
It makes no sense to them.
Yeah.
If they feel something happening,
Then-
then it makes a little bit more sense
Yeah.
to them.
Yeah.
So they wiggle. Because,
And she
Yeah.
certainly is.
right.
She's just a puppy.